Hi, my name is Dr. Nikki Green from Fort Worth Cosmetic and Family Dentistry. Some of you may have seen me interview Dr. Conditt before, talking a little bit about TMJ disorder. That's one of the things that he's doing in his practice next door. But one of the other really interesting things that he's doing is he's treating patients with obstructive sleep apnea or doing sleep dentistry. So I want to know more about that because that's definitely a hot topic in the news right now. It's a hot topic in all the medical journals. You're even seeing commercials for snore guards, things like that. So tell me more about sleep apnea and what you do.
So obstructive sleep apnea is a disorder that is very serious and potentially life-threatening that causes breathing to start and stop when we fall asleep.
Okay.
So when we have sleep apnea, our airway closes off for whatever reason. When our airway closes off, we're not going to breathe. If we're not going to breathe, we're not going to get oxygen to our heart and brain and lungs, which is relatively vital.
So what are some of the things that, if I am concerned about that, should I start by coming to see a dentist like yourself who does sleep appliances, or should I start with my I think that's where I know a lot of patients get confused about sleep apnea, is they really don't know where to start.
There we go. Right. So yes, you can go to your primary care doctor, okay. You can go to anyone like that. The problem a lot of times with that is they're dealing with so many different things that I hate to say they don't have time for it, but it just kind of sometimes gets pushed aside. The best thing to probably do is go to someone that specializes in that. And there are some dentists that do nothing but practice sleep apnea. If you go there, things are going to happen a lot quicker.
Okay.
And a lot of times we may be referring back to your primary care or something like that.
Right.
But starting with a dentist that specializes in that is a good place to start.
If someone truly has sleep apnea, has been diagnosed, can't wear a CPAP, aren't doing anything to actually treat their sleep apnea, are we at a point where that's a death sentence for that patient?
Untreated?
Yeah.
Maybe.
Yeah.
The good thing about sleep apnea is it is treatable.
Okay.
And the most familiar way of treating it is, like you said, is the CPAP. The CPAP it's just a constant flow of air that goes down our airway, but it assures our heart and brain and lungs that we get sufficient oxygen.
It's kind of like CPR.
It is kind of like CPR. That's kind of where CPR came from. But the problem with that is long-term compliance.
Okay.
So many people can't tolerate a CPAP, or they won't even try a CPAP. And a lot of those people have no idea that there's another alternative, which is an oral appliance. Now, an oral appliance works on a little bit different premise, where a CPAP blows air down an airway and doesn't affect the size of the airway. An oral appliance actually brings the lower jaw forward. We know that if we bring the lower jaw forward on basically everybody, the airway is going to open up to some degree. So we wear an appliance that brings the lower jaw forward, opens up the airway, we breathe like normal.
Wow.
I've been wearing one for 10 years now. I have sleep apnea, obviously, and it's literally changed my life. Now I know that my heart, brain, and lungs have sufficient oxygen.
Right.
I'm able to sleep with my wife now since I don't snore anymore.
She doesn't put you in the other bedroom.
She doesn't put me in the other bedroom.
So it might also be good for the marriage. Is that what I understand?
It could be very good for the marriage, yes.
Okay, I'll take that one home. So speaking of, what should we take from that? So from all of that information that you've given us, what should the general person out there know if they know that they're a snorer, their spouse is a snorer? What should they do?
So if anyone has signs or symptoms, or think for some reason they may have any kind of a sleep disorder condition, get tested. It's so easy to get tested now. I mean, we could actually send you home with a home sleep test unit. You can bring it back the following day. Within 24 to 48 hours, we can have a diagnosis. Wow. If you test positive for sleep apnea, get treated. If you test negative for sleep apnea, but you're snoring, treat that. Now studies show that snoring untreated a lot of times eventually turns in to sleep apnea. And if you're absolutely not going to treat it, at least up your life insurance.
That also is maybe good for the spouse. Well, thank you, Dr. Conditt. I really do appreciate you doing this video with me, and then also just you being in our practice. It's
Thank
really
you.
been a lot of fun.
I'm thrilled to be here. It's a lot of fun.
Cool. Thanks.